camouflage, poor result. Contrary to hair transplantation, someone can have a styling or camouflaging products to help direct the hair. In eyebrows, there is nothing that can be done. Complication. Sparse eyebrow may not be considered complication because it can happen, but in any event, sometimes they may grow unevenly, or we can have a poor hair growth, and so that can be considered unhappy patient as complication to the patient. Poor hair angle, hair sticking up, that is the curve I was talking about. So your hair has to curve toward the scalp, it should not curve away from the scalp. Poor direction, and then poor angle. Another thing, I'm sorry, I kind of skipped from one to another. Poor angle would be not directly the upper portion to down and down up, and then a curve away from the scalp. A natural healing, pitting, milia. If we position our grafts too deep, they can either cause pitting, uneven healing, and unsightly result. And poor shape and position of the eyebrow can be a complication. As an assistant, your contribution is in creating great result is making good quality grafts. Dissect follicular units instead of making one graft at a time. What that means is select your follicular units, one follicular units. Do not take two follicular units and break it to make two one-hair grafts, because you decrease the chance of survival. You can also damage the hair. And select your follicular units appropriately, so you really have a good result, because just the thick hair can contribute to the density of the eyebrow. During the placement, place carefully. Keep in mind correct graft size and its position where you put your two follicular units versus one follicular units. Pay attention to the hair curve, and always imagine the end result. While you're placing hair, think about if your hair is curving in one direction, what would look like 6 months down the road. This gentleman is an interesting case because he had I'm not sure if you can see this, on the bottom portion, he has a thin eyebrow, but he tattooed the upper portion of his eyebrow. He wanted thick eyebrows. So we transplanted his eyebrows, and the result you see on the bottom is 1 year after. This is a lady who had direct eyebrow lift. She went to Asia, and Dr. Lam first had to correct the scars. I hope you can see it was indented, it was terrible. And her eyebrows are thin. We're looking at 9 months after the transplant, and we will go again and do a second pass. I will have a little video of this lady. Her story is that she had a surgery to remove mold from her eyebrow, and we repaired just one side. What you see, her left eyebrow was repaired. And the difficulty when you're repairing eyebrow, only one, when you're transplanting both eyebrows, both sides can look alike because the same type of hair will be used. Transplanting one eyebrow, you have to be very careful because you are now risking for asymmetry and really a difference in left and right eyebrow. And I will share. And this is her testimonial. And if it happens, and there it is. Sound.
And I had I want to share about my experience here because I had a great experience. And I had a fine face until I had a little back of my side of my eye, but it was only a quarter-inch big, and found out I had to have no surgery to remove it, and it ended up 3.5-hour surgery with a lot of tentacles, and it took a really big chunk off my face, a big hole about this big. And had to go to several people to get it closed, and it left a very big space in my face, and there was just a little bit of eyebrow here and a little bit here, and I felt really disfigured, and upset me very much. And I was very grateful to find this Dr. Lamb and his group because we couldn't find anyone else who would try to really take my case. And I had a very good experience here. And a man come to me and treated me like a family. And as you can see, now it's been 4 months and my eyebrow's growing in so well. I had a transplant from the back of my head here, and I'm very grateful to Transplant to speak it anymore and to be able to smile and face people. And I'm grateful for the expertise and kindness of everyone here who treated me so well. And it was a very happy experience in every way. And I'm grateful to be through this surgery and done and better.
I used this video just to tell you the reason behind it is when she came to our office, she had a little band-aid to cover this scar. And for most people it would be, oh, just a little scar on her eyebrow, it's not a big deal. For her, as you see, it was a big deal. So never underestimate the power of few hairs. Thank you. And I don't know how to exit. You want to take it?